surprised me with $1,000 a day. That's how much it costs to be there. You get your own private room and all this. It's a nice place, guys. Hey guys, I remember last time I worked clinicals, I had a headache and I was exhausted, and I didn't tell you about my day, and I said I would. So this is my follow-up about what clinicals was like. So the place I am doing my clinicals at is a drug and alcohol rehab facility, and it is definitely by far one of the nicer facilities available. You get private rooms, and you can keep your cell phone with you. You can keep your laptop with you. If you have a remote job, they're like, hey, maybe you need to get a few hours of work in while you're here. You can't just do whatever. I mean, they do have a structure to the day, but you have some downtime, and they're like, if you want to work here, you can work here. So really nice place. Big surprise, they don't take Medicaid. Any place that nice, yeah, Medicaid's not gonna pay enough for that. Actually, all of them there know. I mean, a lot of them are there, their insurance is covering it or covering most of it, but they all know $1,000 a day. That's how much it costs to be there. And I think then on top of that, they're still paying for other things like urine analysis. They get, I think, weekly, and that one's kind of expensive. I don't know how often they get it, but they get labs drawn and urine analysis done while they're in there. I think that's out of pocket, or your insurance has to pay for that on top of the place. So it's an expensive place. It is an old hotel conference center that they have turned into this rehab facility. It has a little pond on it. You can go fishing there. It's not a big pond, but it's big enough you can go fishing. Beautiful outdoor area. They were playing volleyball in the evening when I left. There's a pool table inside. There's an indoor pool inside. It's just a nice place, guys. And the residents there also, they knew they were in a nice place. They were thankful to be able to recover in such a nice place. A few things surprised me about this. So first, my history of inpatient facilities is working at two different boys' homes for at-risk youth back right after I graduated from college. So like group home settings, troubled boys that were, getting in trouble with DCFS, their parents. A lot of times we're having a lot of trouble. These were not kids with good home backgrounds, not kids that were making good choices. They were violent places at times. You constantly, you didn't work a shift without hearing kids getting angry, losing their temper, and cursing at the very least. And often you didn't work a shift without seeing someone get physically aggressive. That's the inpatient I have experience with. And then the other inpatient I have experience with is when I was a teenager, my youth group would volunteer at, it was called Whispering Oaks Mental Home. Maybe it wasn't called Mental Home, Whispering Oaks something. But it was a home for people who could not function in society due to their diagnoses. And we're talking about like severe schizophrenia, severe bipolar, stuff that just, these people were not able to function in society. And that was always, I loved going to that place. I loved talking with the people there. That was always fun. But that's my experience. Inpatient has had people that are angry, aggressive, or, not even able to function in society, hold down a normal, 9 to 5 kind of job. I don't think I thought too much about what the patient population would be, other than I remember saying, well, this is a schwanky drug and alcohol rehab facility. They don't take Medicaid. You get your own private room and all this. But I didn't think about what the actual people would be like. And I didn't know what size this place would be. It was a lot bigger than I thought. This place has 85 beds, and I think it was almost full. People stayed there at least 30 days, some of them up to 90 days. Unfortunately, many of them, it was not their first stay. I mean, relapse is common no matter what program you're in, and so some of them had been before and they were back again, trying again to get clean. But very diverse population. More men than women, for sure, I would say. Seemed that way to me anyways. And the age range was, maybe early 20s all the way up to maybe 70s. It was all ages in there. And I did hear cursing, but never anyone who was angry at someone. I never heard any cursing in anger. I just heard, it's people who, that's the language they use when they're just conversing normally. They weren't angry. I never saw anyone get mad at anyone there. The whole 12 and a half hours I was there, everyone was very polite. Now, that doesn't mean everyone was happy. I did see nervous people, like, the foot twitching couldn't stop. I saw people that looked tired. I saw people that looked antsy, people that were down. I mean, when you're there, it means your home life's not going well. And like one of them, his wife had just served him divorce papers the day before. So I don't want to say it's, everyone's all, woohoo, I'm at a resort. No, they're going through a hard time, but they knew they were at the best possible place they could be to get better. And the day was interesting too. So their day, they would come down to, first they would come to the behavioral health tech's office and get their vitals taken. And then after they get their vitals taken, they would come over to the nurse's station and get their own meds. And there were 2 nurses doing meds. So my preceptor was one of them. So he had about 40 patients that came by and got meds. And he gave them as they came by. He didn't call their name. They just came to see him. And all throughout the day, if it was a med time, if they needed PRN meds, they would just stop by his station and he was there. He would do quick assessments with them. How you doing? How'd you sleep last night? And just kind of, take note. But it wasn't anything in depth. That was more, I think, the counselor's jobs to do that. So after they get their meds, I think they go eat breakfast. And then I believe it's starting at 9 a.m. They have 6 group therapy sessions that are almost back to back. They stop in the middle after 3 for a lunch break. And in between the first 3 and in between the last 3, they have 15-minute breaks. But 6 45-minute group therapy sessions. And I was able to sit in on 3 of them. And the dynamic in the groups was just really good. Like I said, a very diverse group of people. These are not people that, other than having an addiction problem, looked like they had a lot in common necessarily. I mean, you have that many people in a room. Groups were like, I feel like there was probably about 4 groups for that whole facility. So probably about 20 people in a group. Of course, I could kind of see like some of them would sit near someone that was a similar age range, and they had their people they were a little more comfortable talking to, but they were all interacting great. The counselor was much younger than most of them in our group, and she still did a great job facilitating the conversations. And I got to sit in on a nursing group, so nurses can teach things about medical stuff. So they can teach about the clinical manifestations of anxiety. They can teach a group class on sleep hygiene. They can teach a group class. The one I sat in on was on sexually transmitted infections, because if you have a drug or alcohol problem, you are at a higher risk for having risky sexual behavior. So yeah, that they had a group on that. It was a fun day. It was a relaxing day for the most part. I feel like it's a place I would enjoy working. One other thing, I didn't go off campus with them, but they do go off campus on the weekends, or their group therapy sessions are 6 days a week. On Sundays, they don't have therapy. I think they do things on Sundays. And they are doing like field trips in the community, normal things they would be doing if they weren't in rehab. And the point is for them to learn how to interact in society sober, how to be social in society sober. So like, for instance, they went golfing last Sunday, I think, and this one guy's like, I was golfing all the time before I came here, and I was always totally drunk while I was golfing, and I would golf with my work buddies, and there was always alcohol, and he's like, we went golfing, and I didn't drink, and he's like, the group behind us had alcohol, but I didn't drink it, so I was seeing it, but I wasn't participating in it. Obviously, you can't go steal the other group's alcohol, but they went to a bowling alley, and a guy's like, I sat at a bar and people were drinking and I didn't drink. So I don't know how much details I could put for HIPAA. I don't think any of that's identifying information, but I said to my preceptor, I'm like, did they go on a outing to get pedicures? He's like, yeah, I knew that because there was a guy that had his toenails painted, and they looked nice. I was like, that's some gel nails on those toes. And I just thought, I bet that was an outing. And he's like, I want to get out of here. What the heck? I'll add a color. But yeah, it was a neat place. I mean, I don't ever want to need a place like that. So definitely seeing people there who are trying to deal with putting their pieces of their life back together, dealing with the consequences of their actions. It's a reminder not to get into these addictions. But if you have a drug or alcohol addiction and your insurance will pay for this place, man, it is the place to be. And I felt like my preceptor saw them as equals. I felt like everyone working with them there saw the residents as equals. They were not treated like, they're lower than me, they're dumb, they're crazy. They were just treated as people who had an addiction problem they were trying to get over. It was a very, very good environment. Lunchtime, you have to clock out. The preceptor said he has to clock out for a 30-minute lunch break no matter what. Lunches was included. Lunch was decent. It wasn't like the best food ever, but the carrot cake was amazing. Lunch was included there. You didn't pay for it. Unlimited coffee and juice. They had a salad bar. They had soup. They had grilled ham and cheese and chips and carrot cake. That was lunch. It was included, and I sat at a table with other people that worked there, but our table was in the cafeteria right next to all of the clients' tables. And lunch was, not time to talk about the clients. It was time to eat lunch, talk with each other about, your own lives, and just a good environment. If I was a patient there, I would feel like I was being respected and treated like, a human being. So yeah, I was really impressed with the place. I've only done one shift. I'm sure there's things I didn't see. I'm sure there's negatives. Yeah, it was a neat place. I got a little bit of time to talk more individually with the residents, but a lot of it, they were in group. I was just observing, or I was just sitting in the nurse's station as they would come in and out and get meds. And those were very quick conversations, and I tried to just let the preceptor handle those because he's doing things. It might just look like he's having small talk, but I know he knows who they are, and he was doing, a real quick mental health assessment, and I didn't want to get it in the way of that. But great place. I'm looking forward to it. I wish that I could have 90 hours there instead of 60 and do more like 60 with labor delivery, because that sounds gross. But yeah, only 60 hours, so only 4 more shifts there. I go again tomorrow. Looking forward to it. So that's my clinical place at the Drug and Alcohol Rehab Facility. Really great experience. Really great experience.